Hi, this is Liz. I'm just giving you a report on one patient from the night shift. Uh, this patient is 84 years old. She identifies as female. She comes in with some shortness of breath and a congested cough yesterday afternoon. She is Native American and she lives with her daughter and her son-in-law. One thing to mention, she is deaf, but she's been deaf since she was pretty young and is fluent in American Sign Language. Her son, who is her healthcare proxy, not the son-in-law that she lives with, but another individual. Her son is a healthcare proxy. He's at the bedside with her, and he is fluent in American Sign Language. Her past medical history: she's got type 2 diabetes. She has a non-healing ulcer to her right great toe, and is followed at the wound clinic for that. She also had a stroke about 5 years ago and has some residual difficulty swallowing. Speech therapy did come and see her already, and they recommended that she follow a soft diet while she's in the hospital. She's also had frequent urinary tract infections she's been treated off and on for. And about 2 weeks ago, she had a hernia repair done. That was, uncomplicated. She did fine with it. The incision is pink and there's no drainage, but she does still have steri strips in place over the incision site. There are 8 of them. Let me see just a little bit about her assessment. So her vital signs: her temp this morning is 99.4 orally, her pulse is 88, her respirations are 16, her blood pressure is 122/80. Her oxygen saturation is 96% on room air. She has scattered bronchi in her lung sounds, but she's able to cough and clear it. No obvious shortness of breath or dyspnea, just this congested cough. The stuff that she's coughing up is kind of yellowy colored tan, and we did get a sample and sent it off to the lab. She has not been up out of bed since admission, so I'm not really sure how she moves, but her skin is intact with the exception of that ulcer on her toe that was there when she came in. She is alert and oriented. Her Morse fall risk assessment scored her a 20. She's continent of urine. I don't know when her last bowel movement was, but she does use the bedpan appropriately. For provider orders, we are to titrate her supplemental oxygen to keep her saturations greater than 94%. She is on a diabetic soft diet, and she's getting her blood sugar checked before meals. Her activity right now is out of bed as tolerated with assistance, but like I said, I have not gotten her up yet, nor did the nurse last night, so I'm not sure how well she moves. For medication, she's on IV azithromycin, 500 milligrams daily. She's ordered for acetaminophen, 650 milligrams by mouth every 6 hours if she develops a fever of greater than 100.1 or any pain greater than 3 out of 10. And that is pretty much it for her. If you have any questions, let me know, and I hope you have a nice shift.